So glad to see you all here. I am about to begin the meeting of the Health, Hospitals, and Social Services Committee. I do detect a quorum. Today is Tuesday, October the 15th. And the first item on the agenda is that we have to select one member of the Health, Hospitals, and Social Services Committee to serve a 2-year term on the Metro Action Commission. Is there anyone interested in doing so?
I can comment on it because I've served for the last 2 years in that position, and I found it to be quite rewarding. And they meet monthly on Thursday. I can't remember which Thursday it is every month, but they meet at the lunch hour and they meet at the Metro Action Commission office. And it's certainly valuable to have a council member there to keep them in the loop and be involved. So I found it to be a good experience.
So that was the whole time commitment was meeting once a month essentially and then reporting back what we need to be reporting back?
Meeting once a month at the board meetings, they last generally about an hour. They'll ask you to do a couple of other things as well. Can't do. Some council members make meetings, some don't. But to be effective in that position, I think it's important that you make the meetings, and having a liaison to the council's important to them and important to us. So.
And if I may, Chair, I served on it the first 2 years I was on the council. Yeah, and so it was, and you're right. It is sometimes a challenge because I want to say, for some reason I'm thinking it's the third Thursday. Yeah, but I'm not certain that it is. But it is a good thing because they do some really good work.
Outstanding work. They really do.
Well, since I don't have any takers, my office is right down the street from a Metro Action Commission, and I guess I'll
nominate you.
I'll second.
I'll nominate Council Lady Hertz.
So, all in favor?
Aye.
Any opposed? Then so it will be. 6 of us. Okay. The next item that we have is Resolution 2019-42. Mendez and Hurd, and I have a letter from Councilmember Mendez asking for approval. It's a grant agreement of the Homeless Management Information System between the U.S. Department Housing and Urban Development and Metro MDHA to the Metro Social Services Department Homelessness Commission to contribute to the national effort to end homelessness. Can I have a motion?
Move.
Second.
Anybody here from Social Services? Yes.
Hello. I'm Abigail Dowell. I'm the Assistant Director for the Metro Homeless Impact Division. And just so you all know, technically this is going straight from HUD to us at Metro Social Services. There was a typo putting MDHA in there. Legal has assured us that can be amended, but we would appreciate a vote to move this forward as we need to have this grant agreement into HUD to be able to start receiving that funding. But this will help us to increase our homeless management information system here in the city, which we are the lead for, and will help us to unduplicate the number of individuals that we are seeing in Nashville who are experiencing homelessness, which will give us a much better picture of how many people who are experiencing homelessness, and it will provide trainings across the city so that we have more accurate data entry. Overall, it will just help increase the data that we're able to put out and show even to you all and to our other city leaders as to how we need to best approach our methods to solving and ending homelessness. So.
Awesome. Thank you very much. Any questions? Yes.
Give me the number on that one again, please.
2019.
RS or BL?
RS 2019.
Okay. Then
42 is the number.
yeah, I know, but I mean, while we're being quote assured, if the language is in there, I'm wondering if you, Chair, or whoever, we can move. What are we doing? We want to strike MDHA? Mm-hmm. All right, we need to strike MDHA. We're going to ask for a suspension of the rules and strike MDHA to where the money flows properly. Otherwise, it's going to have to flow the way we pass it, and it'll be coming back to us. So, I mean, correct me, we don't have legal in here, but correct me if I'm wrong.
So you're basically saying that you want this money to come directly to Metro Social
I think
Services?
that's what you just
That's
said.
what the HUD grant agreement is.
Yeah.
It's a-
Okay, so, but the grant is between HUD and MDHA.
And Metro Social Services.
MDHA was the
Resolution's
typo.
wrong.
Yeah,
Okay.
it goes to social services, right?
That's what the homeless impact division is.
$150,000?
Okay.
But it says
It
MDHA.
does, it does, it does.
So, Madam Chair, can we recognize Mark, please? And, I mean, you're about as close in the legal that we've got here to, I mean, if it says it in our resolution, and if we pass it, that's what we're
The way
doing.
it has to go.
That's right.
And we'd also like to get the money as soon as possible, so we don't have to wait 2 weeks or 4 weeks to.
Okay.
I serve as the vice chair for the homeless planning council.
So
anything
I
you
don't.
can do to help us would be great.
I don't care, Chair, whether it's yourself or myself, but I'm going to move, or you move, one, that we strike MDHA. That way the money flows properly, and we just need to amend on the floor.
Okay.
So we need to suspend the rules in order to get that amended?
That's correct.
Right.
That's correct.
So do we approve it here and then just,
I'm going to go ahead and make the motion that we strike MDHA in committee,
okay,
and that either yourself or myself, one, will ask for a suspension of the rules, or anybody else on the committee, I don't really care, a suspension of the rules to strike it on the floor. And if possible, if you're able to attend rules,
Somebody.
if you can't do it, I can. And that way I'll go ahead and I'll bring it to the rules and tell them why we're doing it.
okay.
Are you available to be able to be there for that?
Here, I'll be
5:30?
over today.
Yes.
I'll be over.
Okay.
I second the
And you're on the
motion.
committee,
I'm not on the road committee.
but I was planning on being there, but between us.
If you're going to be there, that's fine.
Well, I know
Okay.
Councilwoman Porterfield said she would be, but it wouldn't hurt.
That's fine.
Because, things come pretty fast.
I just want to make sure that I think, given what you've just said to us, Mark, I think we need to make sure that we strike it and suspend the rules.
Right.
Okay.
So, good. Thank you very much. And we all agree to that?
Call for a
Well, I've moved for the
Is that
strike.
second?
Seconded.
Second.
She seconded it.
Okay. All in favor?
Aye.
Any opposed?
Now I move the bill as amended.
Second.
Is there a second?
Second.
All in favor?
Aye.
Any opposed? There being none, thank you. Okay, now the last thing we have is Bill 2019-13. It approves an agreement between the Nashville Fire Department and Vanderbilt University Medical Center for the clinical training of Vanderbilt residents.
Move.
Second.
Okay, would you like to say anything regarding this bill and a grant that you will be receiving?
I certainly can. I'm Fred Smith, EMS Operations. This is a pretty symbiotic relationship between Vanderbilt residents and the National Fire Department. Residency has 3 years. The first and second year residents will be riding with us, both on ambulance or chief's car, some of them in an observant role, some of them participating as medical control. Third year, certainly, they're all doctors, but it's a great opportunity for them to be able to see this side of the world where they otherwise would not have that experience of pre-hospital care, and they take that back to their wherever they work in emergency medicine. That'll certainly enhance their ability to care for patients that come in by EMS, and it's good for us too because we have a doctor there that we can ask questions to or feed off of. So it's good. It's a good program, and it doesn't cost anybody anything.
Awesome. Yes.
No cost to the city at all for this arrangement.
That is correct. As I'm told, there's no cost.
That's my understanding as well.
Just their time.
It sounds like a pretty good win-win for me.
Me too. Any other questions, comments? All in favor?
Aye.
Any opposed? There being none, it moves unanimously, and the meeting is adjourned. Thank you all very much.
Thank you.
Thank you.
Thank you.
Thank you.